Hotel health and safety. My name is Jonathan Cunningham from Storm Consultancy. We're a UK-based health and safety consultancy that provides health and safety for commerce and industry. In the next 3 minutes, I'm going to show you some of the key points, critical points for managing hotel health and safety. We're here on site in Downhall, down in Essex, and I'm just going to go through some of the 6 stages to make sure that you've got adequate health and safety in place for your hotel or similar sort of establishment. The first thing is make sure you've got suitable risk assessments or documentation in place. This involves having a policy in place that clearly defines from the highest level the importance of health and safety. Also, to make sure that you have your organisation arranged, so it's clearly defined who is responsible for health and safety in the organisation, and also your arrangements, how you organise health and safety in the organisation and across the hotel. The next thing is to have suitable risk assessments in place. These do need to be comprehensive and take in a number of different areas. I'm just going to go through them very briefly. These are the sort of areas that you should be considering. First and foremost, fire is probably the most critical of any of the risks in a hotel. This involves having a suitable and sufficient fire risk assessment by a competent company. Also making sure that you have adequate measures in place for your fire system and your fire alarm. In addition, Legionella similarly, you must also have a risk assessment in place that is adequately managed and implemented by the rest of your staff. The management of contractors will be a critical one. Please make sure we've got a policy for that in terms of the induction, access, control, and also the supervision while on site, and that you have suitable due process for assessing them when they come onto your site in terms of their own documentation and risk assessments. Asbestos is huge. Ensure you have a suitable risk assessment in place so you know where it is, it's been assessed and it's suitably managed. Food hygiene is always going to feature in any sort of hospitality area or establishment, making sure that all staff, include those that handle food, are basic food hygiene trained. Slips and trips, particularly in bathrooms, make sure you've got suitable signage, you have a bath mat and also a towel that they can step onto. If you have spa pools or pools of any sort of nature, make sure that they feature under the correct legislation. This will always be an issue. If there is any pool over 1.49 metres in depth, then it has to have a permanent lifeguard on duty. So please be very aware of that. Please refer to the correct legislation on that. Falls, particularly windows. You can see some windows behind me. Make sure these are suitably stopped to allow children and to make sure the children can't get out. Also lift shafts as well. Also falls by contractors from any rooftops, particularly flat roofs, particularly if they're going to anywhere where there might be exposed tanks, such as Legionella testing. Scalds is also going to feature, so make sure you have good mixing in place and that the water temperature is regulated before it gets to the residents' rooms. Violence, particularly directed at staff by possibly intoxicated staff, is also featured, and also cash handling. Other things that you want to consider, so they're the main risks. Other things you may wish to consider is having safe systems of work in place. This is identifying all the different departments from hospitality all the way through to bars, banqueting, kitchen staff, maintenance staff, that you've identified the more hazardous activities that they conduct, and therefore there is a safe system of work. It doesn't have to be complex, just 1 to 4 or 1 to 8 on how to do that procedure adequately. Make sure your staff are adequately trained. This involves making sure that it might be food hygiene, it might be health and safety, it might be working at heights. Training normally goes into mandatory training, specialist training, and also annual training. So make sure that you've at least assessed that in some detail. And the final one really is the record keeping. Make sure you have adequate record keeping across your organisation and a good internal heartbeat for managing your health and safety. So regular meetings, an independent, possibly consultant or consultancy such as Storm, to come in, Finally, hope that has been a bit of help for you. If you'd like to get in touch, it's stormconsultancyuk.com. So that's stormconsultancyuk.com, and we're happy to advise you and keep you safe. So that's Jonathan Cunningham. Please get in touch with the website below, and any other problems, then don't hesitate to give us a call.